Dissociative fugue or psychogenic fugue is a rare condition in which a person suddenly, without planning or warning, travels far from home or work and leaves behind their past life. To really understand dissociative fugue, we must first explore the mental condition of dissociation. Psychopathology, dissociation happens when thoughts, feelings, and experiences of our consciousness and memory do not collaborate well with each other. The DSM-5 defines dissociation as a disruption or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. Uh, Patients show signs of amnesia and have no conscious understanding or knowledge of the reason for the flight. The condition is usually associated with severe stress or trauma. Trauma is defined as how the mind responds to severe mental injury. Mental trauma involves painful feelings and frightening thoughts invoked by witnessing or experiencing a traumatic event. While most people process and deal with these feelings after a short time, some people are unable to do so. With dissociative fugue, we experience dissociative amnesia. And because persons cannot remember all or part of their past, at some point they become confused about their identity and the situations in which they find themselves. In rare cases, they may even take on new identities. The American Psychiatric Association classifies this disorder as one of 4 dissociative disorders. This disorder is extremely rare, affecting only 0.2% of the population, nearly all of them adults. More people may actually experience this type of disorder in the midst of serious accidents, wars, natural disasters, or other highly traumatic and stressful events. The use of alcohol and other substances will exacerbate this condition. The primary focus for treatment is to deal with the traumatic event that set off the fugue. Psychiatrists absolutely needs to be involved. Recovery from fugue is fairly quick. Usually memories come back. If the traumatic event is not dealt with, the fugue episodes will return. The goal of treatment is to come to terms with the stress or trauma that triggered the fugue. A person in the midst of a dissociative fugue may not exhibit any symptoms. They may only be slightly confused. It may be difficult to spot someone experiencing the fugue. After a while, the patient will show signs of confusion and distress because they won't be able to remember recent events and realize that the complete sense of identity is missing. Most fugues are brief. They last from hours to days to months. They can last up to years. Even though it's not possible to prevent dissociative fugue, it might be helpful to begin treatment in people as soon as they begin to have symptoms. Quick intervention following a traumatic event or emotionally distressing experience might help reduce the risk of developing this disorder. The best way to help someone who has suffered a condition like this is to learn all you can about trauma and PTSD. The second step would be challenging your beliefs. Help someone in trauma takes time. It takes patience. It takes understanding that trauma and PTSD is very real and can have a serious effect on a person's life. If you or someone is struggling with any type of trauma, please call 1-888-344-8837. They are open 24/7. Thank you.